and ascend with us. And it's all about you and I together, excuse me, collaborating together to make sure that 2025 is a great season for both AvMed and for yourselves. Whoops, I apologize. Let me go back here. Technical difficulties. There we go. All right, so give a little bit of history of AvMed for those of you that aren't familiar. We are around 55 years old. We are one of the oldest and largest not-for-profit health plans in Florida. So that's something that a lot of people don't realize, that we are not-for-profit. We offer 3 lines of business: our individual and family coverage, our Medicare Advantage coverage, and our group business. So as you can see, Medicare Advantage, we offer in 6 different counties. That's Miami-Dade, Broward, Palm Beach, and then Osceola, Seminole, and Orange up around the Orlando area. Today, what we're discussing, our individual and family coverage, we are in 22 counties. Here are some of the counties listed in Miami-Dade, Broward, Palm Beach. So those are sort of our major metropolitan areas and our tri-county area down here in South Florida. We will have a coverage map later on in the another slide that'll kind of show you our West, Central, and North Florida coverage. And then our group employee coverage is 52 counties across the state. So the great news is because we've got such a vast coverage map on our group side, and we built out a lot of relationships over the years with different entities such as the state of Florida, Marriott, other different entities. What that has done is allowed us to build out our network pretty broad all over the state. Therefore, the counties that we are in, the coverage and network is pretty rich. One other exciting little piece here, it says AvMed was recently acquired by Centera. It's actually been almost 2 years now, so but still fairly new to us. They are an integrated non-for-profit health carrier delivery system up in Virginia, over 130 years of history. As you can see, a lot of employees, over 30,000 employees, multiple hospitals in Virginia, North Carolina, lots of different other healthcare network servicing vehicles. And as far as their provider list, their carrier list goes, we are now their 3rd carrier in their portfolio and bringing their membership to a little over 1.2, close to 1.3 million members now between Virginia and Florida. A little bit about our mission and value. So, our mission is to improve our members' health every day. So you're going to hear a lot of that throughout the presentation, right? We're very much into discussing preventative health and allowing our members to know all the different benefits that we have as part of our plans. Our vision is to be the healthcare choice in our community we serve. And so how we do that is we have a lot of different added benefits below. We're not going to cover all of them today in great detail, but I will cover a couple. So look forward to sharing with you a little bit more about the AvMed Smart Shopper, as well as RX Saving Solutions, amongst others. We are building a healthier tomorrow together. Again, we are in a collaborative mode with our agents, and we want to make sure that everyone has the same mentality moving forward that we do when it comes to serving our members. So we're going to go over our 2025 Qualified Health Plan Off and On Exchange and Trust, our core product overview. Excuse me 1 second. I apologize, getting over a little cold, so coughing. 2025 Qualified Health Plan and Trust product portfolio. So the Entrust plan, our core plan, is an HMO plan. It does have a pediatric dental DHMO embedded that offers a 0 deductible through Delta Dental, our great partner on the dental side. The coverage is available to age 19 birthday at effective month. There is also an integrated adult dental, a DHMO benefit plan offered in select plans through the Delta Dental. And we have an integrated adult vision benefit offered through eye care. So we'll go into a little bit more detail with these in a few slides. Key highlights here, right? Usually when people ask you about your plans, they want to know how rich the network is, and they also want to know where your pharmacy and your drug benefits are aligned. So our pharmacy network is through Express Scripts. We have a pretty typical pharmacy formulary of a 4- and 5-tier plans. 5-tier includes the value generic. Retail cost share 90-day, right? And mail delivery supply order available. We definitely want to encourage those that can afford to get a 90-day supply of medicine, because obviously there's cost savings available to that as usual. Some of you may be familiar from a telehealth side with Teladoc. Our partner is MD Live, so pretty much the same format, right? It has a great platform for them to be able to utilize telehealth through MD Live. And then our lab company is Quest Diagnostics. I think everybody's familiar with Quest Diagnostics. They're on every corner now, like Starbucks, so they're pretty much everywhere. So a little bit more in depth of what our product portfolio is for the Entrust HMO, right? As I mentioned before, we are in 22 counties in the state of Florida. They're all listed below here. If you're taking notes, here are some counties I really want you to write down, because these are counties that we're having a focused growth effort on this season and are very going to be fairly competitive from a pricing standpoint. So you're going to have Broward, Pasco, Seminole, Lee County, Alachua, your Gainesville area, Lake, Duval up in the Jacksonville area, and Palm Beach. So those of you on the call that sell multiple counties, right? Those are the counties that we're going to be highlighting this year amongst all of the 22 counties as areas of growth opportunity, specifically on the opportunity for pricing. From a coordinated care standpoint, all right, PCP selection, assignment required, referral and authorization of specialists are required. And as you can see, we have our standard design medal levels for gold, silver, and bronze available in all counties. And this slide is just a little bit bigger of a